hosted by the Student Engagement Club at Iowa State University. So we're so excited that we have a group of energetic and passionate students who are interested in supporting their community during their time at the university. So we have a new club that has developed in last spring semester. We're gonna let them just introduce their club a bit. They've created a clip that they'll show us. And I also wanted to just give some orienting of things that you might look forward to in this semester. So in U-Turn, we're going to try to balance your new virtual world and all the demands you're having, as well as making sure we have opportunities to continue to be engaged together. So one thing that you should be looking towards in October, we should be sending out a survey to existing U-Turn members and then folks that might be interested in joining this year. So once you get that, feel free to share it with all your friends and colleagues who you think might have an interest in getting connected. My little teaser is that if you fill out that survey, one, it's going to do something. The first goal is really that it's going to share for the world on our U-Turn website some general things about who our members are on campus. So like at what level do you study, and which populations are interesting to those that are part of our network, and so on. But secondly, it'll help us organize a little about where your priorities are in the next year. And if you fill out the survey, you will be receiving something in your campus mail. So you'll be getting some U-Turn swag. If you're not on campus, I'm pretty persistent, so I will make sure that you get it in another way as well. So it'll just be a little token of appreciation, but you could feel free to wear it to the Engaged Scholars talks for the rest of the semester, or pin it on your winter coat, whatever works best for you. Our team leaders, our team science leaders have started meeting and organizing this semester as well. So the team leaders are getting up and going for the way that each of the 4 teams will function over the course of the fall and spring semester this year. So you may start to hear from them. We will begin our dissemination and implementation science groups again. That was had a lot of fruitful conversation and I think project ideas. So we're going to plan to hit the ground running in October. So as we talk today, we have a pretty, I think, cozy group. So I would say feel free if there's things that are coming up that you want to just discuss. I know Gabriella is pretty flexible with that in part of her discussion. But if you feel more comfortable using the chat box, feel free to do that, and then I'll be monitoring the chat along the way. When she's finished, we'll have just a little extra time that we can kind of think together and discuss some of the concepts that she brings up as well. Okay, so before we get started, we're going to just check in with Bethany. She's going to share our Student Engagement Club's clip so that you all can be aware of what some of our engaged students are doing on campus as well.
Yeah, hi everyone. My name is Bethany. It's great to meet you all. I'm a PhD student in Human Development and Family Studies and the founder and president of the Community Engagement Club. So I have here a clip that we have created to help people understand what the mission of our club is, and I hope you enjoy.
Do you have a passion for community engagement? Do you want to apply your skills and research to improve communities? Maybe you're looking to volunteer at organizations you care about, or help facilitate volunteerism in your community.
Whatever your drive, we want to help you reach your full potential. If you understand the importance of improving our communities and want to join a group of like-minded people, consider joining the Community Engagement Club. The Community Engagement Club is a place where you can stay connected across campus and your community. We work together to find and share opportunities on campus and across the state of Iowa. We love our communities in Iowa, and we want to improve health and well-being for both our generation and generations to come.
As a group, we work to partner you with faculty who share interest and can serve as mentors in your community engagement. We also seek out community leaders across counties to join us in our engagement efforts. Mentorship is the core of our success, and we want to equip you with the skills you need to make an impact.
We are here to help you engage in causes you care about. Maybe you are interested in mental health awareness and public health. Maybe you're a junior scientist looking to improve sustainability or improve access to social and economic resources. You might even be looking for more ways to volunteer within your community. As a club, we work together to pave your path to growth and success.
Making an impact means bringing change. Change happens as a result of smaller individual impacts to larger collective impacts, and everything in between. Ultimately, our impacts improve our communities across the state of Iowa. Making a positive impact is a drive all of our members share.
This is your chance to be a leader. We give you the space to take initiative and inspire others. There are lots of opportunities for leadership within the club, many of which can shine brightly on your resume or CV. Sometimes engagement happens from a distance. We understand that you can't be everywhere in person. This might be because of public health concerns, a lack of transportation, or simply not enough resources to be as engaged as you would like to be. Because of this, we seek and promote flexible engagement opportunities. We look forward to having you as a member of the Community Engagement Club. You can email me at bmccurdy@iastate.edu for more information, or check us out at stuorg.iastate.edu/2940. Awesome. Thanks for your attention, everyone.
Of course. So we always play good news, bad news at my house. So the good news is that we have this excited, engaged group of students out there that are really passionate at Iowa State. The bad news is none of you can join the club as a student. So, but they are, just being funny, but they are certainly looking for community partners and faculty members to learn from, and they'll become more and more involved, I think, in the Engaged Scholars talks as the semester gets going. So they're gearing up for Club Fest coming up soon. So without further ado, I'll just introduce today's speaker, who we will claim, as she has worked and collaborated extensively during her time at Iowa State. She is also currently a postdoctoral research associate at Washington University in St. Louis. And today she's going to talk about work that she has done related to the SWITCH project, with her presentation that's titled Evaluating School Wellness Programming Through an Implementation Science Lens: Research, Practice, Policy, and Implications. All right, Gabriella, thank you so much for letting us learn from you today. We are all yours.
Hi, thank you so much, Ashley. That was great. And also a great video from Bethany. That was so cool. As someone who's making videos for this Switch program, it's so hard to make a good one. So that was awesome. So given that it's like a bit of a cozier group, I'll try to sort of keep an eye on the chat box. Sometimes in presenting it's a little bit hard to keep an eye on it. So just anyone, if you have a question, just feel free, or a comment, or you know, an insult, feel free just to throw it at me. But as introduced, I'm currently at WashU, but still working tethered to Greg for a little while, and the awesome team of Switch. So they will not get rid of me for a little while now. And so the goal of this sort of talk, I think, is really try to focus on some of the practical implementation science research that we've been doing, and trying to think about how to actually have that constant feedback loop of translational work. And so the real goal is to enhance practice, but we have to kind of study that first and make sure that there's a strong case for the things that we are doing that's grounded in our practitioner-focused lens. So I'll do a quick overview of what D&I is for people who might not be that well versed in it / might want a refresher, and then that kind of like sets the tone for some of the terminology I'm going to talk about in this presentation, and then I'll present some policy implications for D&I related work. I had this plan to have you guys annotate the slide, but Bethany and I piloted that before, and I think some of the stamps that you guys can use sometimes stay on the slide. So what I'll do, instead of just ask you guys to put in the chat box, if you don't mind, to respond to this question, and that is, what is your familiarity with dissemination and implementation science, or D&I for short? So is it not much, which means that you aren't involved in that many projects? Is it a little, which means that you could be planning some projects, but maybe you haven't got involved just yet, but you can know roughly what it is? Is it a lot, that you have done lots of research in D&I before, or you still have no idea what D&I science is and you came for the free food? So just let me know what your thoughts are here. I really appreciate you guys getting engaged. A lot, little, a little. Okay, not much. Okay, brilliant. So it's a good mixture here. And so I really say this because today in this position I'm in at WashU, we are one of the implementation science Cancer Moonshot funded initiatives. It's actually called the Bo Biden Cancer Moonshot Initiative, but they can't say that because of current tensions. But I think one of the opening remarks from the NCI was that so many people kind of claim to do implementation science that we don't have a full grasp of what that is, or sometimes it's misapplied in certain contexts. And so I think, you know, as researchers that work with predominantly human subjects and community-based settings, I think we should all be kind of aware of some of these key terms, just for the betterment of our work and the impact it's going to have on the community. So as you will probably know, it's, you know, D&I is the process by which evidence-based interventions are implemented and put into practice. And so there's different frameworks. There's actually a plethora of frameworks, which makes it really confusing. The NCI and the Division of Cancer Control and Population Scientists is probably the main overarching body that regulates and funds D&I work, but there are also different branches in the NIH that do this work, and there are more institutions such as the NHLBI that are starting to fund a lot more of this work, especially as it relates to prevention of chronic disease. But one thing I kind of wanted to get across was there's this distinctions between implementation outcomes and implementation determinants, because a lot of the time, and this is I'm guilty of this, because a lot of the time we work with schools and community settings, we're trying to think about how to get them to implement better, but sometimes we're doing so much work to try and get them to that point that we forget to kind of explore some of the factors that could be impacting implementation. So there's a few different frameworks. One I'm sure that you've all heard of is REAIM, which stands for Reach, Effectiveness, Adoption, Implementation, and Maintenance. There are also different frameworks for implementation science, such as the Interactive Systems Framework. And one I'll just kind of go over briefly is the Outcomes to Implementation Research, which was developed by Nola Proctor, whose group's at WashU as well. And so this kind of helps us to conceptualize, like, what do we actually mean by implementation? And she sort of posits this as a plethora of different terminologies, but they can kind of be grouped into these 8 different buckets of the top we have from acceptability, adoption, appropriateness, feasibility, fidelity, compliance, penetration, sustainability, and cost. So I think a lot of you can kind of make a strong assumption as to what those different outcomes might be, but a lot of the time, I'm sure you can make a wild guess, but a lot of the time we focus so much on this fidelity and compliance, or potentially adoption, that we don't always think about trying to get at some of the other outcomes that are just as important, or can help to contextualize a lot of the things that we are finding in our research and just isn't talked about. One thing I will say as well on this note is oftentimes these sort of implementation outcomes can be more meaningful and more sustainable than behavior change itself when you're applying an intervention. And I'll get more into that later on in the presentation as well. And then again, just to review some implementation determinants. So these are the kinds of things that are we sort of use to determine how well an evidence-based practice or policy is implemented. A lot of the time we see in school-based research that people are doing really, really great intervention work, but in their process evaluation articles, they cite lack of time, lack of resources, and lack of staff buy-in as barriers to getting stuff done, when really that's just one small determinant within one setting. And so this kind of really blows the field open a little bit to explore some other ways in which we can intervene and help support implementation. So one framework that I'm guessing quite a few of you have used or have worked with before is the Consolidated Framework for Implementation Research, and that was developed by Laura Damschroeder, and they're based at the VA Center at Michigan. I like this a lot because as a school-based researcher primarily, and sort of branching out into other settings, it does paint a nice multiple ecological picture of factors that influence implementation. So just to kind of give you a really brief overview, we've got 5 different groups of factors that are known to impact implementation. And this is based upon, consolidation of lots and lots of different intervention research articles. So, on the top left here, you've got intervention characteristics. What's the information source? Do people believe that this is an actual intervention that they could implement? What's their perception of design quality and packaging? Do they think it's going to actually help them in their setting? Is it complex? Is it trialable? Lots of these things that can determine whether people are actually willing to develop and implement intervention. We've got outer setting, which really pertains to things outside of that setting. So, do they feel like their patient or their student and staff needs are being met by other authorities? Do they have relationships that are outside of their organization? Ways in which they feel that other peer-to-peer relationships can exert a positive or negative sense of peer pressure on the way that they approach implementation. And then other policies and incentives that might or might not support what's going on at their site or in our case, a school. And then we have inner setting factors, which really relate to that school level or organization level capacity for implementation. How well do the people within that site coordinate and communicate with each other? What's happening in terms of the social structure and hierarchy? Is it, a flat level hierarchy, or is there a top-down approach from decision-making to the person they actually expect to implement? And those kinds of things can really impact implementation. And then we have in the middle here, the characteristics of our individuals. Are they skilled? Are they knowledgeable? Are they self-efficacious about actually being tasked with implementation, and how do they feel supported or not? The degree to which they feel supported in their own profession as well is a big indicator of how they're going to implement a new evidence-based practice. And then in terms of that process, what's happening in that planning stage? Are they engaging the right people? Are they having the right champions to actually launch something and sustain it? And again, that execution stage of actual implementation, how well they reflect and evaluate. These kinds of things are all known to impact implementation from an empirical standpoint. And so this provides a really nice way for us to kind of look at both within and outside that implementation setting and understand ways in which people can actually facilitate implementation, but through ways that you might not always have thought of. Sometimes certain things just don't work in a particular setting, and it's important to investigate why through a really sort of in-depth approach. And then finally, implementation strategies. And these are really the how-to components of interventions. How do interventions actually work? How might they be implemented better? And so you might have an evidence-based practice or an intervention that you want to kind of start launching with a particular site, but then realize that based upon needs assessments and initial pilot testing that they might have really poor communication systems or lack of stakeholder buy-in. All these kinds of things can lead to the development of implementation strategies, and these are just but a few of ways in which researchers and other support systems can help at the institutional level. So that kind of brings me on to Switch, and so I have to kind of just first acknowledge that Switch is a very interesting project, and I have to owe a lot of this work to Greg and the team before that have come to develop this program to the point that it is now. It really is a true dissemination and implementation project. And so the goal of this, of our initiative, is to help schools build capacity to develop and sustain comprehensive wellness programs. because through such implementation, effectiveness, support, and ongoing improvement, that is really the key way to facilitate student health outcomes. One quick snippet of how this work is just needed is recently, this last year, I gave a talk in a particular department and was talking about switch and the school-based interventions, and a question was asked, but it was more of a comment, one of those questions, where someone said, you know, this is great, but how do you really expect to gain momentum in schools when, you know, reviews and meta-analysis of research with school-based health promotion shows that nothing really changes when you intervene at a school setting? And I was like, that's why you need implementation science, because we don't study what's happening between that intervention and outcome. And we just expect that because we give kids or schools equipment and money and a person to implement that they're going to be able to yield, you know, significant increases in student physical activity, and they're going to drop like, you know, 25 pounds. And it's just very interesting to see some of the gaps in research and understanding around why implementation is important, because it really helps to explain so much and doesn't really leave as much to chance when you do have an effect in the intervention. So originally, the team at Iowa State, so Dr. John Teal and Greg Welk and Jerry Eisenman, who were here, and a bunch of other faculty, they tested the degree to which switch, what you do, view, and chew, the mantra, could be adopted into the school setting. And so through a randomized control trial, they tested the effectiveness of this intervention, which is run primarily through the home, and provided curricular materials and implementation support for schools and families to really impact children's health behaviours. And so they did find it was effective in that students' health behaviours such as physical activity, nutrition, and screen time all improved, and parents seemed to really enjoy the programme. And so from this, the foundation was built to kind of take it from switch, what you do, you chew, to school and integration targeting child health, which is what it is now. And so this schematic kind of shows the bidirectional relationship between the school and the home environment, and the key facets of the model that help to make switch effective, and also flexible enough of a process by which schools are able to actually implement and sustain wellness programming. So at the top, you can kind of see the school setting. The intervention takes place predominantly within 3 key settings, and that's purely because of the curricular materials that have been developed and integrated. So we have the PE setting, whereby teachers receive a module and instructions and curriculum development for PE and ways in which they can infuse switch concepts into their PE lessons. And then the classroom is the same kind of thing, with weekly tracking, encouragement taking place there, and lots of curricular content that aligns with switch principles. And then the same thing in the lunchroom, which I think if Lorraine's on the call, Lorraine was a big leader in helping to promote assessment and evaluation to help improve the school lunch environment. Utilization of those modules, plus meeting as a school wellness team, plus coordination with the rest of the school, kind of comprise those best practices. And then if you can kind of see this continuous do, view, choose cycle, it operates on a 12-week implementation phase, whereby each week is a focal point on either physical activity, screen time, or nutrition behaviors. And so through that, we were able to kind of instill these different practices in school wellness teams, and they help students to track their behaviors online through a website. And that self-monitoring principle is a key mechanistic feature of the behavior change model, and really helps students to become more cognizant of their health behaviors. And it also facilitates parent engagement, which you'll see at the bottom, which helps parents become involved also through the website and become engaged with their students' health behavior. There's a sneak peek at the website, which I'll go through a little bit more in detail at some point. But as you can see, a key mechanism is this self-monitoring component of health behavior on the part of the students. And that's a key feature of our switch emphasis model. Briefly, the ways in which we train schools to actually adopt these best practices, we kind of have this overlapping Venn diagram. So on the left-hand side, you can kind of see this participatory intervention development process. So we have our switch expert team on the left. We work directly with 4H Extension, and in fact, they're taking over most of the programming as of this year, to help engage schools, recruit schools, to develop training materials through online resources at the bottom, and then also through our web interface, through our community of practice, which is now this year become a Facebook page, We enroll schools in the website and we train them on how to actually engage students and parents through this interface. And then they establish these switch implementation teams. And that can be a team of, we try to recommend about 3 people per team, and that can be anybody from the school setting. That could be a school nurse or a classroom teacher, a PE teacher, or an admin, anybody who wants to take part and wants to lead this effort. We really encourage that it's a diverse team because they would have naturally more reach across that school setting. And then on the right-hand side, we really try and promote the use of our materials in different settings to promote healthy environments and to try and engage students in that decision-making process, whereby they're tracking their behaviors, they're listening, they're engaging in activities that help them to learn about health behaviors. And then that kind of takes place in the school setting. As a result of implementation, the school becomes, we hope, we're trying to study this piece right here, the capacity of the school wellness team and the actual school as a whole to implement and sustain this program is really predicated on the support that we're providing to them, but then also their baseline capacity and also what's happening in their school setting as well. And so it's kind of messy, but you can kind of see this continuous feedback loop that we're trying to achieve to learn from the schools as they learn from us. And here's the website again, so you can kind of see there's different profiles for students, parents, and teachers. And so anyone can make an account and they are linked with a particular school. And then once they do that, in terms of the student interface, this is what the tracking platform looks like on their end as well. Depending on what week it is, that's the behavior that they get to track, and they can also set goals as well based upon what they're working on. So one of the baseline needs assessments that I think makes Switch unique is the use of a school wellness environment profile, which comprises not only what's happening at the school in terms of the quality of that wellness environment, but also what the organizational and psychological factors are that could be the implementation. And so I'll show you that assessment in just a second, but in terms of that needs assessment, one of the keys that the key practices that we like to use in Switch is data coaching. And so we really provide results to schools in a timely fashion in a PDF report that looks like what you see on the right-hand side of the screen. And so that really provides schools with feedback on data that they provide us, so that actually is something they can use. It's something they can put in their school improvement plan to meet ESSA requirements. It's something they can put in their triennial assessment for the USDA requirement. And so it's customized feedback that's going to help them make those decisions based upon the areas of strength and weakness in their school. And so we can kind of see over here, we've got assessments of the PE environment, what's happening in terms of before and after school, how are staff engaged, what's happening in the lunchroom, and then they can kind of see where their scores are and make those decisions about where to intervene first based upon their own school needs and challenges as well. And then on the student end, I won't talk about this too much since I want to really kind of discuss the implementation outcomes today, but we do actually assess before and after the intervention student health behaviors through the YAP, which is a tool developed by Greg and Pedro St. Maurice, who was also a PhD student here. And so that is a calibrated self-assessment that students complete, and it's 20 questions assessing each of the physical activity, screen time, and nutrition behaviors as well. So they have questions on in school, outside of school, and they have view questions, and then also chew questions as well. And then once they complete that, they also receive a report, and then we give the schools a report based upon student data as well. So that again allows them to see what's happening at the school level, where are some of the areas that their students are doing really well in, what are some areas that they could be room for improvement, especially in that school setting as well. And so to really conceptualize this in this overly simplistic and easy to follow logic model, on the left hand side you can kind of see the Switch team working with the 4H team, and really the goal is to work with and through schools to develop this real self-sustaining structure through webinars, online support, to try and help schools implement their quality elements and best practices in the school setting that hopefully trickles down into the rest of the school and the home environment. And through such practices, they want to engage parents and children, but also engage the rest of the school in implementing modules and different practices and tracking in different school settings to really try and enhance both the school and home environments, that we ultimately enhance students' chances of getting opportunities to take part in activity, to reduce their screen time, and to eat healthier, ultimately reducing that risk for obesity in childhood. So we kind of shown some of the basic tenets and mechanistic features of switch, and so that in implementation science terms, that's going to be classed as our evidence-based practice or evidence-based intervention, so EBI, and you probably hear those terms floating around. So now, how do we understand how to get something like switch into practice, and how do we actually study those processes? So initial work, what we've kind of accomplished over the last few years, so before I even got to Iowa State, the switch team conducted a feasibility study. And so again, if you remember back on the initial slides, we had feasibility as one of the implementation outcomes of interest. So feasibility is a huge step to take before you try and disseminate an intervention into practice and into the public context. And so that was a mixed method study of trying to understand, are schools actually satisfied with switch? Do they feel they can do switch? Do they feel like it's going to actually benefit their school environment, and what's happening in terms of that implementation? And so findings from that really helped to, I think, show disparities in implementation at the student level. And so following that, we wrote a paper to try and understand, or did a study trying to understand what was happening in terms of the tracking, and how was that actually going to explain some of these changes in student outcomes. And so what we found was that students that were highly engaged in tracking versus those that weren't so engaged, those were the ones that saw bigger increases in physical activity behavior and decreases in sedentary behavior as well. And so that's, again, trying to explain some of the ways in implementation effectiveness and how that can actually show the difference between implementing it and then implementing it well, and how that might impact student health behaviors as well. And through this, we're promoting system change, right? So we're trying to think about that switch framework. How can we engage school hubs and wellness teams to implement our quality elements of modules, tracking, planning, and engaging parents in the rest of the school setting? How do they implement those modules in each of those PE classroom and lunchroom settings? And then how does that impact our student health behaviors? And through that process, we work with schools where they start, and we really try and instill lots of goal setting ideologies, and then also data-driven assessment practices as well, to really help them to think about making realistic change as opposed to just doing our best practices or doing the whole 9 yards in their first year. As we know, that's not really going to be feasible. And then through that, we hope that schools are well positioned to meet those USC requirements for their triennial assessment, which means they have to evaluate their wellness environment every 3 years and report back. And that's a lot for schools to do, especially when none of them have much training in this area. So that really left us at a point where we had some idea of implementation outcomes. So if you look at the Proctor framework again, I think we can say that we've addressed that adoption and feasibility. I think we can sort of say that schools did sort of implement the intervention with some fidelity and compliance, and they did find it, they were satisfied. So that first criterion of acceptability is there as well. Not where we want it to be completely, but again, we have to kind of meet the schools where they're at. In terms of the implementation determinants, some of the early findings from that feasibility assessment, as well as the tracking paper, we found that planning and meeting as a core team was really helpful. Engaging those champions to really lift up some areas of the school setting were key to implementation. And then in terms of execution, the tracking and the module implementation was one of the key factors that were driving some of those outcomes in terms of the student health behaviors. I feel like that's also what a lot of studies report, and a lot of interventions we see kind of still ride that same train in terms of talking about fidelity and compliance. And so I think in the last couple of years, we tried to move beyond that and talk about, okay, so these schools are implementing, great, but what is actually driving implementation, and how can we study that in more innovative ways? And so the goals of the last couple of years, particularly 2018-19, before we have this strange thing called COVID, we really sought to understand how schools adopted and implemented switch through a mixed methods approach, but we also wanted to see the degree to which some of these factors within that CEFA model were more or less influential depending on what the school experience was, what their classroom climate was, what their overall context, how that might have interplayed in implementation, so that we could hopefully make refinements for the year that's just taken place, and really trying to understand, okay, how can we make this better, and how can we make schools actually implement our best practices with more fidelity and confidence and sustainability. So if we look back at what influenced implementation, this is essentially a breakdown of the SEPA model. There's a couple things that I want to kind of just pass out a little bit, because I think we have a lot of implementation frameworks, but there's not a lot of school-based implementation frameworks. And so some of these terminologies, it took a long time for me to really learn them and to really think about how they would actually be useful in a school setting. And quite honestly, I think that a lot of the reasons why we don't see a lot of implementation science research in schools is because a lot of the gap in translation occurs from that clinical setting, from the NCI to people who are doing school-based work. And so it's just starting to resurface now. So a couple of things. When we talk about relative advantage in intervention, that really kind of gets at to what degree do stakeholders at the school level think that switch or another evidence-based intervention is going to help them. And a lot of the time, I think we as researchers, and I've definitely been guilty of this, kind of just assume that a school wants to do our program. Like, why wouldn't they? It's great. Like, we have funding, like, just go. And so I think that was one thing that I really wanted to understand is, like, what did they expect to get out of switch? And that really helps to determine what's potentially down the line in terms of implementation outcomes. Some of these characteristics that are happening in the social structure, so things like collaboration, school wellness team communication and teamwork as an internal team, but then also working with others in their school setting. I think that was a really important thing to look at. Readiness or capacity for implementation was a huge factor for us to explore, because if they didn't have the people in place, the buy-in they needed, that was in our mind a really big indicator of how well they would do. We also wanted to look at the peer pressure and cosmopolitanism aspects of these schools and how well they felt they were well networked within different contexts. Iowa is a very sort of interesting state in that you do have a lot of these farming schools in rural areas that we worked in. So we wanted to see schools feel, connected to different schools or different areas or different organizations, and how would that impact their implementation. And then planning and engaging, what were they using to plan? How are they actually engaging key stakeholders? And we know that through other school-based research that you don't have staff buy-in, you don't have an intervention. That was a really big goal for us to understand. So another doctoral student that worked with us, and he's now a faculty member, Joey, developed a measure of readiness and capacity at the school level. So as I mentioned before and showed you the report for the school wellness readiness assessment, that's framed in the organizational readiness for change framework. And so there's two different components here. You've got organizational and then individual. And so both of these trickle down into structural and psychological factors. And so again, thinking about ways in which individual or organizational capacity could impact implementation is really important, because those are the kinds of things that are underlying factors, and they're also underlying reasons why people say they haven't got time, or they say they couldn't get staff buy-in. It isn't so much that time is the barrier, it's that capacity is the barrier, it's that their priorities are the barrier. And so that really helped us to dive down a little bit more and understand what's going on in the school context. So we did implementation measures, so at checkpoint surveys, we asked them what they were doing, how well they were going with implementation. We also trained extension staff, and I'll talk about extension in just a second, but we trained county level extension staff to do checkpoint calls, to help schools check in on their goals that they set, to also plan and reflect on what was happening in their school setting. And that was a really key implementation strategy for us, is to have that individualized support for implementation. And then we also conducted a final interview at week 12 with external interviewers who were outside of the Switch project as well, to get some honest feedback on how it went, some of the barriers and facilities to implementation, but then also feedback on how their extension support staff member was playing a role in that procedure. And so that timeline is just here, so you can kind of see on the left, we've got at week 0, we have that capacity assessment, and then other YAP and SWAP data as well that we collected. And then we had a checkpoint call halfway through towards the end, and then a final interview. And we also reassessed capacity at the end as well. And so over that 12-week implementation cycle, there was a lot of data being gathered, but we did it intentionally spaced out to try and get that sequential change in time as well. So overall, we saw some good findings for changes in capacity and readiness. So in the classroom, the PE, the lunchroom, and then overall school, we saw some key changes. As you can kind of see, the biggest changes happened in the lunchroom and the PE setting, but those were also the ones that were starting off a little bit lower as well. So we tried to break it down and tried to ask schools at that half point in that checkpoint survey what they were doing and how they were implementing Switch. And so we asked them if they were meeting, had they launched the website, had they got youth leaders involved, and then parents. So as you can see, I think for the most part, schools were implementing fairly with good fidelity, but that youth leadership piece, they couldn't figure out how to get their students engaged and how to bring them in as key stakeholders. In terms of the classroom, we did see increases from week 6 to week 12 in terms of using the modules and the posters we gave them and using tracking to reinforce those themes of Do, View, Chew. Lunchroom, we saw overall decreases with the exception of that tracking reinforcement. And then in PE, we did see increases that mimicked some of what was happening in the classroom setting as well. One thing that I really wanted to look at, and this is something that really kind of draws on the health equity lens a little bit, is how not only how implementation impacted capacity change. What we can see here is that obviously with the higher implementation group, there was a change, but I wanted to parse this out and look at our lower income schools versus our higher income schools and just see how much implementation was changing between those school settings and how much that was actually impacting their overall changes in capacity. So we can kind of see that even though we only had a small sample of around 30 schools, that jump from sort of a negative change in capacity for those high implementing schools compared to between low and high SES schools, I think was a big take home finding, and that's kind of led me to what we're wanting to do in 2020 as well. Just for time, I don't want to go through every single interview slide, but basically what we tried to do is understand in that interview data and checkpoint core data, what was actually happening in that school setting, and how did the school wellness teams internalize these different factors as to how it impacted implementation. And so one of the ways in which we did that was a very, very in-depth and arduous coding process to understand both inductively and then matching it to the CIFA frameworks using deductive coding, what was happening in each of those different settings, and was it a positive or negative influential factor. This is just an example slide, and just for time I'll just skip through the other ones, but I'll send you guys these slides if you want to look at them. The other second goal of our evaluation was to see what was happening in terms of extension involvement and basically what was their perception. Do they feel like they could actually do this job in supporting schools at a local level? We're based in Story County, but we also had schools all over the state. As you can see, these stars are all over the state of Iowa. And so we wanted to really position staff from Extension to be this support and this mediator role, and to really help drive implementation efforts as well. So we did find they were overall really engaged, which is great. They attended our trainings. They also took part in our wellness conference in the fall, and they also came to webinars, which is wonderful. They felt that Switch was really a good way for them to build relationships with schools. Training for Switch actually helped them in many ways become better Extension coordinators at their county level for other programs. And then they mentioned that for future involvement, they wanted a much more organic approach in terms of how they actually helped schools. And so for this year in 2020, we really tried to scale back and sort of say, listen, you haven't got to do the checkpoint calls, you don't want to, but if they help, we'll help you get those organized. And so hopefully that feedback helped to drive a much more organic and streamlined approach for this year as well. And then finally for this year, we're still analyzing data, but what we wanted to do was take some of the findings that we had from the last year and apply the same principles, but to a larger sample. And so through the checkpoint surveys and interview data collection, we wanted to apply the CIFA qualitative coding analysis protocol to our data. The distinction is that we framed our interview guides in CIFA much more thoroughly and systematically, and data gathered at each of those constructs that related to each of those constructs in the model. We essentially coded every school's interview transcripts, and we assigned a positive or a negative score to each of those constructs, depending on what the school said and how they felt that impacted implementation. And that allows us then to essentially generate both qualitative and quantitative numerical data to essentially score what was happening at the school level. And that's going to allow us to run some much more quantitative analyses, such as correlations, to try and see what actually might have been driving implementation, and then breaking that down into low and high SES schools, percentage minority, to try and see what was happening at some of those schools that may be more marginalized than others, and then also taking into consideration their experience level, et cetera, et cetera. So those analyses are pending, so I don't really have much to share on that end just yet, so I apologize. Finally, for implications, policy and practice, for school stakeholders, I think that we really need to focus on providing much more technical support to school wellness teams in terms of just trying to, first of all, get a policy in place, and then secondly, have goals to actually help them implement it properly and to assess it, and then help them to realize that this can go into their school improvement plans for wellness as a part of that Every Student Succeeds Act mandate as well, not only the USDA assessments, but also in that overall school improvement plan. I think a lot of them do see the benefit of programs like Switch, but it's one thing to see the benefit of it, and then another thing to have them be able to do something as complex as this. So it's a big leap for them. And then for research, I would just say, implementation quality, I think that is a bigger piece than behavioral outcomes, and that wasn't necessarily what we're seeing in the last 20 or so years of school-based health promotion research, but it really is. And I think as much as we can try to convey that and trying to increase the quality of implementation of these evidence-based practices, then those outcomes will come. I think also just, again, trying to meet schools where they're at and trying to develop implementation strategies based upon those patient or student or whoever it is your stakeholder group is, their needs and resources. I think that's a big takeaway from what we do as well, and the ways in which we learn from schools. So just thanks to everyone from the project team who been instrumental in getting this going, and I will stop there and just thank you guys for listening.
Thank you. Thank you so much, Gabriella, for sharing and your willingness to share your work. It's so interesting. I realize I'm here, so I was doing lots of nodding, just thinking about how some of the work that we're doing in behavioral health is just so parallel to some of the concepts that you talked about. So I really appreciated it. But I want to save time for others' comments too. So I'll just up the floor for any discussion, comments, questions that were coming up as Gabby spoke today.
I know I was that good, but it is also Monday.
I'll jump in. I was just impressed with all of the different frameworks. I kept thinking, I need to remember this one, and then you would say a different one. I'm like, oh, I want to remember that one. So I would love it if you could share that presentation with us.
Absolutely.
Because there was so much there that we could all learn from.
Yeah, absolutely. I'll send these slides over to you.
And we do have space on our U-Turn website too. So Gabby, if you feel comfortable, we could make sure that these are shared. Our recordings are also available to others if they want to review it after the talk.
Yeah, absolutely. And I can do a PDF as well if people don't want to have the PowerPoint or something. Yeah, there's a lot of frameworks. That's half the problem, honestly, is trying to just tangle through everything and pick which one works best for your context and situation. I stumbled on CIFA, to be honest with you, and it just kind of seemed to fit a lot of the things that we're trying to explore. And in 2018-19, we kind of applied it post hoc in some ways because we were trying to get this really big, comprehensive view of what was driving implementation. But in reality, I wish I'd gone back and really done what we're doing this year sooner, but hey ho, you learn.
And I love a framework personally.
What, sorry?
I said, I love a framework personally.
Yeah.
But you did take a lot of things that, those of us who do, work with schools or communities, these are the things that we all talk about, but putting them together in a concise way, was really great.
I think it was really helpful for me to hear some of your thoughts about delineating the determinants versus outcomes, because implementation science can feel like a lot of framework. So certainly I think we reviewed like CFR and some of the outcomes work in our Team 1 discussions last year with the Journal Club. But I think you've given us like a fruitful launching off point too, to look at some of these other ways to consider what might be impacting implementation over time. Okay, so I truly appreciate all of you hanging in at the end of the day. I know our clocks have went past 5 p.m. today, so I appreciate you all shifting to a little bit of a later discussion time. I did want to just plant a seed for where we're headed with our Engaged Scholars talks in this fall semester and then into the spring. So we have a few talks that are pending in October, November, and February. So our thinking is that we'll take a break in December and January just because of the way that the semester is falling this year. And we are going to work hard to balance expertise of community partners and campus partners. So we have, just to give you a little, some examples, we have a community initiative program contact who has said we really want to engage more with Iowa State faculty on projects that are impacting the communities of Iowa. So that talk will be pending later this fall. And we've also explored ideas with community partners who have specific expertise. Now that we live in a virtual world, we have the flexibility to go right into the community during our Engaged Scholars talks. So we'll be hearing from folks with expertise in a variety of settings. So stay tuned. Those announcements will come out as the meetings are confirmed, and our goal will be to make sure we get you that meeting invite about a month in advance so that it can be blocked in your schedules. If others have any questions about the Engaged Scholars talks or recommendations, please feel free to reach out to myself or Connie, who has graciously agreed to help host some of these talks moving forward, or our colleague Katie Bruna, who's also going to help out with some of the coordination of the series. Okay, well, thank you so much. We'll sign off now and look forward to seeing you all soon.
Yep, thanks everyone. Great job, Gabby.
Thanks, guys. Have a good one.
Great job,
Bye.
Gabby.
Thank you.